What patients can expect when they have an upper extremity injury, which is anything from the collarbone or shoulder down to the fingertips, is that they will be evaluated by an ER physician or another ER provider, have an x-ray done, and if there's a fracture identified, either a splint or some sort of stabilization device will be placed. In certain cases, if the injury is more severe and there's a deformity present, a reduction or alignment of the bone may be needed. And the ER physician can also do this with or without sedation. The most common upper extremity fractures we see are often around the shoulder, involving either the collarbone or the upper part of the arm or proximal humerus, and then very commonly around the wrist and hand. These can happen from fairly minor injuries or falls, so we see them quite frequently, whether it's the smaller bones of the hand or very commonly wrist fractures, both in younger and older patients. When patients have an injury, you have an option to go to either the ER or to an urgent care. Depending on the severity of the injury, if it was a car accident or something with a higher energy, the ER is probably the better place to go. And urgent care is good for somewhat minor injuries where you can still have a fracture, but if there's any deformity of the bone or the joint, then the emergency room is where a reduction or an alignment can be done. The urgent cares are really not trained to do that. So if there's something that really doesn't seem right about your arm or your leg, the emergency room would be the best choice in that case. Typically, if you have a minor fall or a twist of your ankle, and you really want to make sure that you either don't have a fracture and it's just a soft tissue injury, or there really isn't a significant deformity, but your pain is there and you want to actually get it evaluated, that would be a really good time to go to urgent care. They can see you very quickly, they can do x-rays, and then send you to the appropriate person if needed. If there's anything more severe going on and they identify it, then they can probably refer you directly to an emergency room or get you to another kind of provider.